We are now joined by Dr. Paul Fadeli of University Orthopedics. And Paul, of course, not what Celtics fans or the Celtics themselves wanted to see last night. Jason Tatum going down, gripping his lower right leg. When you saw that, what was your initial thought? We'll get into the injury and all the specifics in a bit, but what was your initial thought when he went down?
The original injury, I saw his head sort of get bumped from someone running by him. I said, boy, I don't really, what happened here? I don't understand it. But when they slow the video down and you can see him just exploding to go for a ball, you knew immediately what he did. It was terrible.
When you saw that, did you think that it was the Achilles, or was there anything else that you thought that it could have been?
I don't know what the MRI showed. I'm sure it's done by now, but 95, 98%. That's an Achilles. He's grabbing the back of his ankle. It wasn't a twisting, turning injury. It looked like just an explosion to go get the ball, and that's how they often occur. And it's why no one will ever know. And then it pops, and then they grab the back of their ankle and usually complain that somebody hit them, kicked them, shot them in the back of the ankle.
Is there anything in the Achilles that leads up to that? Is there any wear on the tendon, or does it just happen when it happens? There's no real explanation.
So you got to say, Kobe Bryant, Kevin Durant, Damian Lillard, they've been playing for a decade or two, and they have a lot of miles, but so do a lot of other people in the NBA, and they don't tear them. And often when you get the imaging beforehand, it doesn't really show much. It's a pretty weird injury that sometimes just pop and it just happens, and that's what makes it a little scary.
When you saw him not putting any pressure on that, what type of, I don't know, I guess I should frame it as, if it is the Achilles, if he did tear it or rupture it, what does the recovery process look like?
Well, this is what everybody wants to know, and this is where the internet will light up. Let's go back to Kobe Bryant. He came back in about 8 months, and everybody said, what a miracle. Dr. Ella Trash, who's actually a friend of mine and I worked with, did some new internal bracing. And so, the athletes can go back faster. What happens to Kobe is about 6 games later, he hurts his knee and he's out for another year. So it's not just the tendon, it's the whole athlete's got to come back. So Kevin Durant now, he spends almost 18 months for his Achilles to come back. He wanted no way that he was going to hurt something else. So the question is, what's the recovery by MRI? I'm sure by 6, 8 months, it's looking pretty good. But for the athlete to not hurt something else, to be all perfectly in the kinematic chain, I don't know if it's really worth rushing these guys back. Now, Jason's younger than the other three we're talking about.
Right. What would the total recovery process look like for someone that is like Jason Tatum, an NBA player, to get back on the court to being his full self if he did tear his Achilles?
Yeah, well, again, we're assuming he did. The surgery is pretty straightforward. You just take the mop ends and sew them back together. What's fancy about this new surgery is it's called you put an internal brace, or you try to sort of support that repair while it's healing. And so they're going to MRI it along the way, and it'll show really good healing over time. The question is, the MRI can't tell you how strong it is to go back out and dunk a ball in an NBA game. This is where it's just going to be a little challenging to say, when can Jason Tatum come back and explode? And I hope they go a little bit slower and not get enamored with the surgical technique, because it's really not about the surgical technique for the recovery. That's when the therapist and trainers spin their magic. It's going to be months and months and months.
Yeah, it's a long time, and I know that's what a lot of Celtics fans don't want to hear. However, it's a complicated injury and one that takes time to heal.
Well, he can come back. The good news is odds are sure he's going to come back. It would be horrible at 27 or whatever he is to compromise his long-term career because they pushed him back too fast.
Absolutely. And a lot of people, you listen to sports talk radio and you're seeing a lot of things out here that people are saying that it could be something other than the Achilles. As a doctor yourself, what else could it really be?
There's all sorts of tendons and ligaments in the back of an ankle. Any of those could have been torn. It's certainly possible the joint itself, there's, a loose fragment cracked off or some other crazy thing. So people in the healthcare world, that's why when we do these interviews, we say, we think this is fairly classic, but if you've been in healthcare for a while, really, until you get that MRI, we don't know. We presume.
And is it normal to have this type of delay for an athlete to not know? Is that more concerning if you're, almost say 24 hours after the injury? I guess you could say we're like maybe 17 hours after the injury and we don't know yet. For a fan that's wondering, is that cause for concern that you don't know? Or is that just kind of how things play out?
It's kind of how things play out. The reality is there are certain tests that the healthcare providers can do in the locker room, which will get you to 99% accurate. There's no doubt about it. So it would be unlikely they're getting an MRI, not having any idea what it is. Really, probably the MRI will just confirm to the healthcare team, hey, this is what you got. All the while, his medical team is trying to figure out who's going to fix it and how do you want to do it. But there's not an emergency to rush him into the operating room.
Right. So what's different about and like I said, we're assuming it's an Achilles tear. Recovery of an Achilles. What's different from that recovery than say an ACL recovery process? Is it longer? Is it shorter? Is it just completely different?
So when we do the Achilles, we're taking the tissue that's in there, and I would tell my patients, we're taking your junky tissue that obviously tore for a reason, and we're sewing your junk back together. Hopefully it's going to heal well, and we got some tricks to unload the repair. This is going to really take time. When we do an ACL reconstruction, the overwhelming majority, we just bypass the torn ACL tissue. We actually cut it out of your body and we completely replace it with a different tissue. So it's to some degree easier. And the recovery is not quite so challenging. The real recovery, is just the boredom of waiting until the athlete can really get back after, 8 months or so. Both of them are long recoveries, but completely different types of surgery, completely.
Do you think that Jason Tatum can return to being what he was before this injury, following this injury?
I think so. We talked about again the prior sort of superstars, and Kobe and Kevin Durant are the big two we often talk about. Yeah, Kevin's still going. Kobe, however, again, my gut was he was the superstar. He went out and shot the foul shots on one foot after he tore his Achilles. He wanted to be the man, and I think he pushed too hard, too fast. And at 34, he was maybe a little too old. I think Jason's got a lot of headroom, and if the repair, I'm sure is going to go great. The recovery, I'm sure they're going to not push this product too fast. Fans are going to go crazy wanting to see him, but I think he's going to come back, and hopefully we'll have a really great career. This shouldn't end his career, not if they can get the recovery right.
For sure. So you would say he would miss next season if it is an Achilles tear.
A pretty good piece of it, and then you'd have to decide again when you come back, we're fighting for a playoff. Okay, you're putting them right into the fire. And, do you really want to do that in a guy who's got potentially, 5 to 10 more years of NBA in him? That's a decision that goes way over the physician and surgeon's head. And that's how do you want to manage this guy long term? And his dollar value, I don't think, trying to rush him back. That would be,
100%.
I think, a bad move.
Yeah, yeah. I mean, and you're talking about the player at that and the person at that point, right? And the health of the person.
Our dilemma, Sam, is that these new techniques allow us to push a little bit. And so if it was the good old days where you just sewed it together, no way possible. But I'm sure on the internet, people are going to be pushing for a 6 month or so recovery to get them back. And it's possible. I don't know if I would take that risk. I don't know if it'd be worth it in the long run.
Yeah, 100%. That's something that you don't want to rush back, especially if you're Tatum and you're him and you have a lot of career left in you. You don't want to have to risk that. I mean, why would you?
And that's my point. Whenever we talk about these interviews, when we manage athletes, it's not you open up the book and that's what it is and here are the numbers. You're really managing their career. And for Jason Tatum, his career is still kind of in front of him. And so, could he come back in 6 months? Yeah. Would I like to see him push it? I don't know if it'd be worth the risk. Again, if you win big. If you lose, you gambled away a guy's NBA career, I don't
Yeah.
think you have to in his situation. He's pretty secure with his future.